A biopsy is a medical procedure that removes a sample of cells or tissue from a living body for the sake of a diagnostic study, usually to determine the presence or degree of disease. There are several different ways to perform a biopsy, and today we're going to talk about a form of biopsy that is done with an itty-bitty needle, a needle so important they named the procedure after it. It's called fine needle aspiration. For an example, let's look at its execution with a thyroid nodule.
So we look at all the features on the ultrasound and then we decide, does the patient need to have a fine needle aspiration or a biopsy of that nodule? The thyroid ultrasound is going to determine the exact size of the nodule, how many are present, and also the specific features that are there within the thyroid nodule. We use that to decide where we go next. Does the patient need to have a biopsy, or does this person need to be just monitored closely? If the size is greater than 1.2 centimeters, that's more concerning. If there is internal vascularity or lots of blood flow within the thyroid nodule, that is more concerning. If the nodule has multiple what's called microcalcification or calcium deposits within the nodule, that is also a concerning sign. And if the nodule is hypoechoic, which means that it casts less echoes than the surrounding thyroid tissue when the sound wave hits it from the ultrasound, that's also more concerning. A solid nodule is more concerning than a cystic nodule. If there's irregularity to the border of the nodule, that's concerning as well.
Fine needle aspiration is one of the most accurate, fast, cost-efficient, and sensitive methods of diagnosing any lump that a doctor or patient might find. There aren't any limitations. It's a procedure that's done safely on anyone from infants to the elderly, and with little fanfare.
The patient will come in for the biopsy. We usually prep them. We clean their neck with alcohol, sometimes with iodine. We apply a numbing medication called ethyl chloride, which actually freezes the skin. And we use a very small needle to aspirate some cells from the thyroid nodule.
Fine needle aspiration is about as painful as having your blood drawn. In fact, the needles used in FNA are even smaller than those used for drawing blood. So any discomfort associated with this procedure is minimal compared to the amazing information it gathers from the aspirated cells.
These cells are used to make slides, and these are sent to a cytologist who will determine if this is a benign adenoma or if there's any malignant cells. The finding from a cytology can be read as either benign or it could be malignant in, again, 5% of cases. It can also be read as indeterminate or atypical cells. And we also have some that are non-diagnostic, although again, if you're really experienced with performing the fine needle aspiration, this is less likely.
FNA is often the first diagnostic method of choice because it provides significant and important information very quickly. From the beginning of the appointment to the presentation of the results, the whole process can be completed in 24 to 72 hours. This quick turnaround time diminishes anxiety in the patient, and the referring doctor can start making decisions about what the next step should be. I'm Dr. Mike Rosen, and you're watching the eHealth Network. See you next time.